Today I want to see about endotoxins. So the genetic material of gram-negative bacteria has a gene which is responsible for synthesis of lipid A, which is a component of cell membrane of gram-negative bacteria. So this is released when the bacteria gets lysed and produces lipid A, which is an endotoxin. So it can also be produced when the bacteria is alive by forming membrane blips which contains lipid A. So this lipid A acts on the TL receptor 4 CD14 of the host cell and initiate a macrophage activation. So activation of macrophages releases interleukins 1 and 6, TNF alpha and nitric oxide. So interleukin 1 and 6 is responsible for fever, and TNF alpha responsible for fever and hypertension. Nitric oxide vasodilation and causes hypertension. And this lipid A is also responsible for tissue factor activation, and which stimulates coagulation cascade and thereby resulting in disseminated intravascular coagulation. And this lipid A it also activates complement pathway. There are many complement proteins, out of which C3N and C5A is responsible for histamine release and which causes hypertension and edema. And C5A is also responsible for neutrophil chemotaxis. So clinically, a patient suffering from gram-negative infections, most commonly sepsis, will have shock, hypotension, fever, edema, and even DIC. So toxicity is less and it is not fatal even in large amounts, and antigenicity is poor, meaning no antibodies are formed against the endotoxins, and there is no vaccines against the endotoxins.